My name is Rebecca Pounds, and I practice in Pittsburgh, Pennsylvania, and the name of the practice is Cherryway Dental. I needed to find a way to kind of separate myself from the business side, but still be able to enjoy the dentistry. One of the main reasons is I have a 2.5-year-old. I just really was looking for some way to have work-life balance because I was just in the office at 5 a.m. and leaving at 7 p.m. and taking work home with me. February 3rd, Angie Nauman posted on the Mommy and Dentist Facebook page, and it was a post about her affiliation with Heartland and how, people have such a bad, misconception about DSOs. And I read that post probably every day until February 14th. It was a Thursday. I meet with my business consultant. It was Valentine's Day. I said, I really think I want to do this. I've been thinking about this, for the past couple weeks. I've talked to Damien, it's my husband, and I just think it's something to explore. I talked to a couple other dentists with Heartland, a couple with some of the other DSOs, and then on that Friday I made the call to Mike and the process was started, and 4 months later we affiliated. So I think, you can hear it from one person and that inspired me, and I know some other women, but to hear multiple people say it's okay to do this, and you're going to gain some of your, freedom back in your life. You just want to let people know that there's sometimes a misconception of what, DSOs are. And, honestly, myself, like I said, eight months ago, I would have probably not been standing here telling you this, but hearing that from her let me explore an option because it was, getting to be to the point where I'm like not enjoying what I was doing. My life has, and my stress levels have significantly changed. That knowing that you kind of could still continue to practice the way you wanted to practice, but have the support system around was why I chose Heartland. And quite honestly, just the doctors that I talked to that affiliated with Heartland versus some of the other offices, I just got the better vibe. From the first phone call with Mike to working with Matt, and then meeting Suki and Nicole, and it just it felt like would be the right fit. I do know it was probably week 2. I remember walking out on a Friday afternoon at 12:30 to get my uncle was my last patient, and we went to go to lunch, and I'm like, I don't have to worry about the office until I get here on Monday morning, and that was the first time in 13 years that I've felt that kind of relief. So that was kind of an aha moment of I did the right thing, because usually I was taking my bags with me and what was I going to take home, what was I going to log on and do, and it was just a really, it was kind of like a breath of fresh air at that point. Really getting back into, what are some of the things that I'd like to be doing that I'm not doing as much anymore, new things out there that I can try to learn and implement into the practice. Really looking forward to getting the scanner, kind of continuing to utilize the different educational tools on, homeroom and the classes, and the sky's the limit, I guess. I probably would tell them the same thing that I heard from, 10 to 15 dentists when I was, deciding as well, is that I have no regrets that, if I would have known what I could gain from being in affiliation with Heartland, probably would have done it sooner. And that's one of the reasons when we talked earlier about spreading the word and telling other people kind of what they can gain from, from the affiliation.